It's almost, let's see, how many do we have? About 24 maybe. Okay, so it's 1 o'clock. I'm going to welcome all those that are on right now. My name's Sarah Boland. I'm with Childcare Resource and Referral, and mostly out of the Waterloo office and in Black Hawk County, and then do some of the QRS, and then work with our consultants in Black Hawk. So, and I'll have Becky introduce herself.
Hi, I'm Becky Elson. I'm a consultant for Black Hawk County for Centers and Homes.
And who else is on here? Is Lori on here? Maybe any of our other Black Hawk consultants? Yep.
Lori and Shannon and Beth.
Okay. Okay. So we've got that support, and we also have Diane Hoffman from Public Health is on. So maybe I'll have Brenda just kind of go over a lot of you are getting very versed in the Zoom stuff, but just any tips and tricks, Brenda, that we just want to let people know.
Sorry, of course, my husband called me at that exact moment. I'm like, I can't talk to you.
That's okay.
Hello, everybody. I'm Brenda. I'm the one that emails you all the time. So thank you for coming. I didn't hear everything just Sarah said in our introduction, but just as far as virtual meetings, you've probably done a lot more lately than ever before. If you're not talking, just keep yourself muted. That helps prevent feedback as people are talking. On your screen, you'll see an option for the chat box, so you can type questions in there, or you can unmute yourself to ask your question. So Sarah, did that cover everything you wanted me to?
Yeah, I think so. And
Okay.
then I guess if you have trouble, we found out too that if you need to just turn off your camera and your mic, you can still hear us, but sometimes that might help with the connection if you're having trouble with the connection. So I think that's it. And Brenda's going to help. So if things come in the chat, I mean, honestly, we really just wanted to gather directors from Black Hawk County together to just have some time to share, ask questions. We're not going to do a lot of talking. We're not going to present a lot of information at all. We really just want this an opportunity for our center directors. And I think we have some other directors maybe from a couple other counties that might be on too. So welcome if you are on. But that's really the goal of this. We also know that a lot of things have flared up, a lot of positive tests, a lot of things just in the last week or two. So we just thought it would be good to get you connected. And one thing to think about before the end, if this is something, we were able to connect with a group of directors when we were looking at emergency childcare when all this stuff first started. But if you guys in Black Hawk want to do this at least once a month, we're more than willing to, but we want it to really be about you. So an opportunity for you to connect. We still will have those bigger peer-to-peers where we've had Heidi Hotvet, where she's usually presenting a lot more information. But we want to give you guys a platform to maybe connect with each other and maybe save some time. So maybe you're hearing the same thing or you asked a question and to utilize everybody's time best, okay? So that's kind of our goal of today. So I guess we want to just, how's things going? Is there something that is working really well right now that you want to share, or just to start those conversations? We've got a couple of questions we have for discussion that we could come up with, but I just wondered if anybody has a burning question they want to ask, or how something's working really well or not working well or challenging. So, or you can definitely, good point, Brenda, you can type it in the chat too and we can kind of read that. So sky's the limit. How's it going? Who would like to share? Some of you are open and some of you are not, correct? Some of you are not. Yep, I see those head nods. So maybe from some of the people that are currently open or somebody that is planning to open, do you have a burning question?
Well, I just have a question. We're at St. Patrick's and we're going to be opening, and I'm trying to figure out how to make it as safe for the kids and the staff as possible. The whole social distancing with 3 through 5-year-olds is hard for me to wrap my mind around. So I'm just wondering ideas, things that have worked. And we're talking about cohort groups, trying to make it, smaller groups, but I need ideas.
So would somebody want to jump in that's already doing that?
This is Carly at Blessed Sacrament, and we've done very well at our center so far. We do smaller groups in the classrooms. We still try to do that 10 and less. We've since day one have had 2-year-olds and older wear a mask in the classroom, in the hallways, and they actually do very well. And then I have a COVID cleaning team, so I have 2 staff members that after the classrooms leave the rooms, they go in and do like a COVID wipe down and spray of toys. And they wipe the hallways constantly. They're wiping my stairwells constantly. They clean up my snack area. They're doing it so far. We've done really well with it. We still don't let parents in. We still monitor, do temperatures, all that kind of stuff.
So Carly, I'm hearing you say a couple important things, that you actually have designated staff that are doing this additional cleaning. So additional staff, or they're designated to just do that for the most part, correct?
All day, yeah. They're just 2 cleaning people that I have that as soon as the kids leave a room, they have green and red circles. They put a red circle that the room hasn't been cleaned yet when they leave the room, so that crew knows to go right in and wipe it. And so those rooms are cleaned numerous times throughout the day. The toys are sprayed and cleaned numerous times throughout the day. And then, like I said, they do the hallways where their lockers are at. Also the stairwells where they're walking down and touching things. As soon as the class does that too.
Okay. Somebody else. Go ahead, Clara.
Yeah, so we are opened. We've been open for about 5 weeks. I have 2 classrooms at the moment. We also are wearing masks. The kids are doing really well with it. It's not perfect, but it stops the sneezing. You know, it catches the sneezing, the noses, the coughing. So it really does do a good job with catching the airborne stuff. Same kids, same classroom, same teachers. It's costly, but it seems to be working. We've had a couple of incidences where somebody's had potential contact. So it's been good that we've got the backup. We also were kind of gonna start I wouldn't call it a COVID team. We're bringing somebody in to do all of our food prep and cleaning after that, because we have 2 classrooms. So we have 2 different snack times. We have 2 different lunch times. We have 2 different afternoon snack times. So I did that job yesterday from 10:30 in the morning until 4. Pretty much all I did. Got food ready, cleaned up tables. Got food ready, cleaned up tables. So that's hard. I mean, I think we're a lot more staff heavy than we obviously were before. That's my biggest challenge, is the finances at the moment. So.
Clara, talk about your backup that you referred to, that you have backup staff in case someone, because you and I had talked about that. How do you have backup staff in case one of your staff members tests positive and has to be gone for 2 weeks? How did you plan for that?
So I've been working off-site to kind of keep me healthy. And then I have an on-site kind of coordinator, supervisor. And then my preschool room has 2 staff, and then my school-aged room has just 1. And so we actually had one of our employees out for 10 days because of a potential contact. So it was good that happened in my preschool room. So I had the staff there. And then we had a second potential. So Monday, Tuesday this week, I had 2 staff out. So then my supervisor went into the classroom. I came in, did her job. But now I'm going back out. So everybody's back. And so that's kind of how we've been doing it. You know, because I do all the financing, all of the registration, all of that, and I can do all of that offline. So
backups, it sounds like, is a big thing of having additional staff, which is additional cost, and having and any of the directors jump in, you know, some of you are more smaller, so you had more consistent staff anyway, possibly, you know, or some of you have a bigger program where you had, you know, you had different staff coming in at different time. Maybe you had some more of your lead teachers there for a good chunk of the day, but you had, so that staffing seems to be still a huge issue. And then knowing that you want to have more staff, it sounds like, but then the cost of that and limiting those group size. How are you guys at capacity? Are most of your programs working at a lower capacity, say like 50% of what you typically can have? I would say probably so. And some that haven't started, I don't know what you guys are looking at for that. Anybody else that wants to share kind of how they're doing it? Maybe back to when they were talking about kind of the interactions with kids. How do you, that social distancing, can somebody speak to that, how it's actually working in the classroom with the kids? Maybe pick a couple times of day that you know, and focus on that space. I think the outdoor space seems more, we can do that. That's easier to spread out. How are you doing that in the physical classroom?
In the physical classroom at Cedar Valley Preschool and Childcare Center, one thing we've used is Velcro dots to put on the floor to make sure people can see visually where they need to be sitting for circle time or for something special going on, so that they know where that distance is and it's clear to them. We've also said reach out your arms to make sure you can't touch anyone around you. We tried to do more activities that are going to be not using things that would be difficult to sanitize, and we do have extra staff available and here regularly, which is working out really well. We were very fortunate this past weekend because Jamie and I have been sharing with folks that we're so proud of the staff and how hard they're working through this time, because it is extra work and it is a challenge. And someone spoke to me over the weekend and wanted to recognize our staff, and with a note that that person and I put together, and a financial donation from that person, he gave each of the staff that are teaching staff and our bookkeeper a financial gift for each of them to recognize their service.
That's awesome.
Very nice.
Okay, it looks like there's a question that we can get to, and some are back to maybe 75% of their capacity. So maybe that's the other thing that, you know, starting small. I know some programs have talked about starting small. So maybe someone has an average of 6 kids daily. Okay. Becky, go ahead. You were going to say something. I didn't want to.
Well, I was just going to read the question. 2 questions. Do we have any clue yet if pre-K in the schools will be held? I guess that's a question for Charlotta, and I see you're on. Also, does anyone have a plan with how to handle online school for school agers if they go back in a hybrid model? So Charlotta, are they going to have pre-K in the schools now? Do we know yet?
At this point in time, Becky, we're still out, and so we're not for sure. The return to learning plan is being solidified. We were planning on trying to do that. I have gotten on board here, so thank you for whoever sent me the invite. I really appreciate it. I know Aaron is one of our partners. Is there another one of our partners online here?
Mm-hmm. A to Z.
Huh?
A to Z.
A to Z.
A to Z is here as well.
Mm-hmm.
Anyone else? Okay, Lori. So at this time, I have not called any meetings because nothing has been set in stone. Okay. So I will let you know, but we're thinking that by early next week, maybe we'll know what's exactly going to happen.
And probably with that, Charlotta, too, is you could have a plan and a plan A, B, and C, and it could change too. So the nature of this is you could start with the best plan and then you might still have to switch it too, correct?
Exactly. As you know, Waterloo was going to, had already went on record saying hybrid. So, you know, that is, you know, face-to-face, virtual, a combination of both, and they have not, Becky, landed on just exactly So
Right.
this week they're getting input from staff, and next week we should know. But I plan on meeting with my partners at that time when I know. But I'm just on here with everyone else, just trying to gather as much information and just as we can. So whoever sent me this invite, thank you so very much.
Well, thank you for joining as well.
Is there any word on Cedar Falls School's plan? We think they're opening August 24th, but we haven't heard anything further.
I have not either yet, Linda.
Yeah.
And I think those, honestly, I'll tell you what we did. R&R has reached out to all the school districts in our 19 counties to just basically say, hey, we're here to help support and partner with you, and to think about the childcare, which I know Waterloo has done greatly, the childcare aspect. You know, you have these plans, but then there's all these other things that could trickle from that, and you have to think about. So we hope to continue to understand what various district plans, because some of you might have families that drive in and, you know, are working here. And so some of the kids, depending on, might go to different districts, or you might have 2 or 3 districts at least in your site, you know, that you're working with and trying to figure out schedules and needs and all of that. So I think it's an integral part of the school systems and the child cares that you guys are going to continue to play. And we're going to just have to do the best we can each day, I think. Don't you think, Becky and directors? It just, you guys want to plan so much that you can, but so much is still kind of up in the air, I think, which is hard.
Right. And one of the questions in the chat, they're concerned about school-age children with online school and being able to give them access to the internet. And we had a discussion about that in our Children and Family Services meeting this morning, because your internet, if you've got 5 or 6 kids all online at the same time, what's your internet capacity to handle that bandwidth with that many kids doing online school? So yeah, that is a concern. But we really can't predict until the schools make a decision if they're going to face-to-face classes on site or a hybrid model, here a day, gone a day. We don't know yet. So we'll keep you posted if we hear anything, but we're hoping the schools will know more in a week or so.
And maybe once that comes down the pike, we could have another meeting that just focuses on some of those return to learn plans and some conversations around that, if you guys think that would be helpful. Because I think there's going to be some more specific questions and maybe even ideas just specifically around that. So we'll circle back to that for sure. Go ahead, Becky, if there's anything.
Well, I see St. Patrick's, thank you, Lynette, that they're going to do face-to-face with students. So it's just, so really, Lynette, you want to know what are the safety practices that other people are putting in place to keep those kids safe in that face-to-face model.
Right.
So,
I feel like we have a pretty good plan for the school, but when you look at daycare and preschool and then our before and after school care, that's what I'm a little nervous about, because it's, you know, they're not divided up as much, and how to make sure that works.
well, and they're still developing their own social emotional learning, so trying to keep them socially distanced is more difficult for those little ones as well. So it really comes down to hand sanitizing and cleaning, like Carly talked about at Blessed Sacrament, and staying on top of that, and your group size, and keeping staff with the same group, and yeah.
Well, that's kind of what we were talking about, but it's good to hear that that's what others are doing. So,
and it seems to be working, so that's a plus too.
Hi, Lynette. Nice to see you again.
Amy, how are you?
I'm good. Hey, I just wanted to say that we are limiting our class sizes to 10 in a room. So that's helping a lot. And then we've set up a schedule where we're having the children go in with their teachers and wash hands every hour. And while they're washing their hands, we have other staff that go in and clean the areas that are used a lot, the tables, and sanitize doorknobs, handrails, things like that. So that's helping a lot. We haven't had any problems at all. Luckily, we have that extra staff too.
So in your, you have one room that's really big and long. Is there just 10 people, or are you dividing that into like 2 ends, or are you doing anything like that in really big rooms?
Just the 10.
Just the 10?
Just
Yeah.
10 most of the time. Diane said we could go a little larger because of the size of the rooms. We have those 2 rooms that are side by side. That we trade those spaces mid-morning so that they can have centers, access to all of the centers. But then those areas are sanitized when we make that switch. That happens before that they go into the next room.
So you're really having to think about those transitions and also planning your activities or your spaces and then the cleaning around that. So it's a lot more planning for you guys, a lot more, just a lot more.
More sanitizing and a lot more staff time in terms of people greeting at the door with masks on, taking temperatures, hand sanitizing, escorting the children to the classroom and marking them in the attendance book because the parents are not coming in.
Okay, that's something I wanted to hear that, and Diane can maybe speak to that too, is kind of that recommendation of at the door, and that means at the outside door, because
we have a small entryway, and the parent, one family at a time, can come into the entryway with their child, and then the family member exits, and the child can come in with the staff person after hand sanitizing and temperatures. Temperatures are taken twice a day when the child enters, again after nap time, and that is true of the staff as well.
So you guys, some of you, do you have a person or it seems like it's a lot more thought through than just setting up a table or having that thermometer there and that person. There's a lot more that goes into that, because then it also, you talked about escorting that child down to that physical space. So that is even more staff. So those that haven't started, there's a lot to think about, but I think there's directors on here that are doing it and it's working really well. Or the best that it can, I should say. Okay, I'm looking.
While people are thinking about that, Sarah, Danielle has her hand up. Danielle, you want to unmute yourself?
Yeah.
Yeah, no, we had a couple of questions related back to the school age stuff. Because we had a parent ask about, what about the kids that are coming from separate schools? Do you keep them all separately then too? Which is a huge question for us about, so then how do you split them up when we only have so many rooms available, and or do you put them between 2 buildings, or how do you do that? And then if schools open up both virtually and in person, then those kids that aren't going to school and only doing it virtually, do you have to keep them separate as well? So not only are you splitting up between each of the schools, but then you have those ones that are there all day. So that was something we never had thought about either.
That is a challenging question, and I presented that question to our local epidemiologist. They are working on that. We don't have an answer right now because I told them when the schools reopen, which is, all of Black Hawk County, what's going to happen with our pre-K through our maybe 4th, 5th grade that do that before and after school. They're mingling with either a center or a home-based children, and then they go off to school, mingle with those children, and then they come back to either the center or to the home. So yeah, that's a big challenge for all of us. I don't know, I don't have an answer right now, but it has been presented to the epidemiologist, so they are working on it. And like I say, we're kind of waiting to see what's going to happen with the schools. Obviously, each school district is going to operate a little bit different, but we have to wait to see what's going to happen with that.
Yeah, which we said we were going to work with our building people and see if we can find other rooms and stuff to try, if possible, to split up between each of the schools if we can. The hardest part for us would be the transporting back and forth, because some of the the vehicles have to go to more than one school just because of the amount of people they hold in each van. That would be where it would be harder to do.
Mm-hmm. Wow.
Right. This is a challenge for everyone, for the transportation, for the teachers, for, you know, for childcare staff.
Becky, you have a call on 6202. Becky, you have
The
a call on
whole, everybody is trying to
6202.
work together to try to figure this out. So yeah, you're not alone out there. So if anybody has some bright ideas on how this can work together for everybody, let us know, because it's a challenge.
And I'm thinking, as those kids get on the van from different schools, do they have hand sanitizer as they're getting on or before they get on the bus, so that we can limit the germs from one school getting on the van for transport? Yeah, those are some really good questions when you start.
Right, when you think about that. And then I also worry about the special need children. I know it's like, what do you do? So I'm not for certain if they're going to be just at home learning virtually, or if they have a special room, special van that they come in. All that is still waiting to be worked out.
Yeah.
And, you know, some of those questions that you guys might get from parents or requests, some of them, you know, in theory, oh, some good ideas, but then in actuality, and I think you guys as groups of directors or individual programs, there are some tough decisions that there's going to be things that you're not able to say yes to or be able to do. You know, it's good to think about, but I could only even see just right now thinking, okay, maybe we could work with the kids that are there all day, and maybe there's the other group of kids that come in from various places, but we couldn't separate them by schools. There's just no way and no room. But maybe middle ground. And then sometimes with some of the stuff, there's no middle ground. And we know that, you know, and when I say this, I'm not trying to downgrade parents, but when parents are stressed and struggling and we're not meeting their needs in the way that they think they are, then they might jump ship and try to go to another center and see if they have different policies or different things. So, you know, the more you guys have similar policies, and I'm not saying you have, you know, but the recommendations are similar, hopefully that will get through to the parents too, that they're understanding, you know, what are some of the expectations of childcare and why they're doing it. And they're not doing it to make families' lives harder. It just is. It is making it harder, but it's to keep everybody safe. So, okay, somebody was asking about sources of different resources like Lysol spray or other things like that. Diane, do you have any just quick recommendations on you know, sanitizing and cleaning supplies, best to use?
You know, everybody wants that quick fix, which is just like, boom, have that magic wand and everything goes away. Unfortunately, we don't have that. I know all the stores are trying to keep as much bleach and other, what do you call those, Lysol wipes on hand, but the companies, as much as they get in, it goes out just as quickly. The cheapest way, it's a little bit more work, but the cheapest way to keep your facility clean is just buy the gallon size bleach. And then, you know, just have to mix it up on a daily basis. If you prefer more of the Lysol wipes and everything, like I say, I think the stores, I have not been out to the stores, but I think they're still limiting to one at a time. So it's very hard to get a hold of that stuff. There's not one brand that I can recommend over another one. You just have to look at what the products that you're using, making sure that they're able to kill a lot of viruses and also the bacteria. First of all, you have to remember, if the area is dirty, you have to clean it with soap and water first, and then you use a disinfectant on it.
And I know getting supplies can be a continuous struggle. And as we get supplies, you know, or things that we can give out, we definitely will let you know. I think it is good to think about those things and plan as best as you can. So if other people have, you know, other avenues or different ways they've worked with stores or different things and can share that in the chat or something, that would be great. Diane, do you want to talk to any tips or anything about what's recently been happening with programs? I mean, obviously we're seeing a lot more cases and positives, and some rooms have had to close temporarily, or centers or things. Is there any, just for the bigger group, is there anything you want to say to that? Because I know a lot of that is so individualized by the program and what's going on, but is there anything globally we can just share?
The main thing I can share with people is because I think we probably have maybe 8 or 9 centers right now that do have some positive cases. A couple have, once you get 3 or more, then Department of Human Services comes in. We consider that an outbreak. And for the best of the center, most of the time they have chosen to close. But again, you have to look at it. Just think about the basics: the frequent hand washing, the social distancing, the frequent cleaning. That is all working to keep our centers and your businesses open, your home businesses. What we are finding through this contact tracing is people are going outside. When the governor opened up the state of Iowa, people thought, hey, the pandemic is over. Well, it's not over. We are still in the midst of it. So we have to be mindful of telling our staff, you know, be careful when you go home after a day's work, of who you're hanging around with, where you're going, because this is part of your job to come back with being healthy and not sick. We don't have any control over that, but again, we can always say, we love to see you back here tomorrow, healthy and able to work. The same thing goes with some of the kids, of who I feel for them, because a lot of times they have no choice as to where they're being taken. But even the birthday parties, the pool parties, swimming parties, things like this that people want to go to, rightfully, we want to have a fun summertime, but again, trying to keep that social distancing as much as possible. Stay away from large crowds, large groups of people. You can still go outside, enjoy activities. You can still have birthday parties and things like this with the kids, but with a limited number. It's just like I say, this, we love to see the centers open. What's happening is, you've probably seen in the Waterloo Courier, unfortunately, we had 2 centers that got some negative reviews because they got the COVID. Well, you know what, the COVID, anybody can get it because nobody's immune to it. So we can't say it started at one center, or this person, don't go over to this center because they've got COVID over there. No, COVID is everywhere. It's just a matter of who's going to get it next. And that's what we're trying to do, is protect our little people, plus our staff, plus ourselves. So again, I mean, I can't say as much. Even if I go out someplace, I've got a mask. We here at the health department, in our building, we are required to wear a mask. I'm in my office right now with the door closed so I can take my mask off. But if I go out into the hallway, it's a mask on my face. And it's just like I say, we look about children, and I'm getting emails from all kinds of schools. Are they going to require the schools to wear a face mask? Depends on each school district. We can't require, but we can highly recommend, if they can, wear them, because it is, even though they're not 100% proof that you're not going to get the COVID or some other virus, it at least is another barrier, and it does help. I've had people tell me, oh gosh, I'm glad that they had the mask on because they sneezed and it was caught up in that mask. We'll have mask protocol for you, but again, it is helping to slow the spread of it. We still, like I say, the frequent hand washing, that seems to be helping. The schools are looking to get in the nurses' offices and also some of the classrooms to get air circulating, outside air. I know some of the buildings do not have windows that open to get some fresh air in there. So it might just be that you take your class outside for staggered amount of time, just to give the kids a mask break and, you know, weather pending, get some fresh air. There's a lot of things that are still in the works. We don't have all the answers, but we're trying the best that we can. So if you guys have any great ideas as to what's working well in your centers or your homes, just let us know. Let Sarah know at Child Resource and Referral, and they can say, hey, this is really working great for us. One thing I want to mention, you know, this stopping the parents at the door seems to be helping. However, I just want to make it clear that depending on your building or your home, people aren't letting parents into their home if your child care center is down the basement, and bring them all the way down the basement to check them in. When we say outside, meet them at the door, that's where we want you to meet them. If you have a center that's located inside a church or another building, and it might be way inside, you might have to walk quite a ways to get in there. It might take you a couple staff people, but somebody needs to meet them at the outside door. Don't let the people be coming in. And that seems to be helping to stop the spread also, is keeping the parents on the outside of your buildings.
I have a question.
Yes.
Is there anybody that has a policy for staff that are leaving the state on vacation or just going for the weekend?
I'm not aware of anybody that has a policy, but we can always make sure that you can always say, hey, be careful of where you're going. If you're going to be flying to the hot spots, and I'm going to give the example of Florida, be very careful. And you can tell them if they come back, you might have to self-isolate for the 14 days because we don't know who you may have come in contact with. And it's really hard now because some of the people are what we call asymptomatic. They're not showing any signs or symptoms, yet they still can test positive for the COVID-19. And if you come in contact, that means closer than that 6 feet for over 15 minutes, you can get the virus. And that's what's scary because this is what's happening here in Black Hawk County. We have a lot of asymptomatic people that are going out into the grocery stores, into the department stores and things like that, and they're spreading it, which is unfortunate. You don't know. You're feeling well, you don't know that you have it until you get tested. And so that's how some of our centers have caught it, and some of our little people have caught it, the staff and the little people, which is unfortunate. But yes, and again, you can always say, hey, we want you to come back. We want you to have a vacation, but be safe and healthy with the choices that you make of where you go on vacation. Stay away from the large groups of people, stay away from the hot spots.
Is there any way that like the centers could share somehow with you guys, like policies and stuff, and then send them out to other centers? Like, because we were just curious on how other centers are putting policies in place for their staff and families, just in case if there was something that we might have missed that other centers might have. Does that make sense?
Yes, it does. And I've had conversations with a couple of directors who have actually put in staff training policies and trained staff on how to deal with the new recommendations and the CDC guidance. They've also put it in their emergency preparedness plan. How many of you have thought of that now we need a pandemic plan in our emergency preparedness plan so that we have that response? And then having this added to your parent handbook as an addendum so that parents know what your policy is, because that gives it some solid boundaries if it's in your parent handbook. So you can do it as a page and send it to parents as an addendum to your parent handbook. Those are also good thoughts. Thank you, Danielle.
Well, yeah. And we can see about that. Let me check into that. And EPI, I'll just be honest, does have a policy that we need to follow, and it does regard travel, and it does regard going out of state for employees. So there are some things that we have to abide by as an employee, or we need to let people know. And so I'll see if we can share some of that too. But I think if some of you are willing to even share, it doesn't even have to be the whole policy, even some points to consider. And that might be something we definitely can share with the whole group after the fact of things to consider. Maybe not writing the whole policy, but here's 5 things to consider. Because I think as we keep going on with this, the more consistent policies you have in your program and for your staff, everybody kind of knows what to do. And then if you don't know what to do, then you ask. Okay, you better ask your supervisor if you're going out of state, or what's that going to look like. Some have it more than just if you travel on an airplane. It could be if you go out of state, if you're in big groups, it could, so you would see that definitely more in other businesses. But I think more and more childcare programs are having some kind of things like that. So yeah.
Yeah, no, I just kind of thought about that because I figured it would help, as you guys said, to put everybody on the same page. And I mean, we've been thinking of more and more things over time, but just in case we have even missed something that we're not even thinking of as well.
Right. So maybe we could at least start, because I know up in the Mason City area, they had a director's meeting kind of like this too. And maybe some people from public health and whatnot were on there. And I think they were talking around policies. So we'll see what we can come up with, at least to maybe start the conversation, send something about things to consider, to get you guys to start thinking about that. And then we can kind of see where we can go about actually maybe sharing some different things like that. Okay. Those are great thoughts. So I just wanted to quick, when we were talking about masks, the Volunteer Center for Cedar Valley, I put the email address for Lauren. I would encourage, before we were saying, hey, just send them to CCR&R. I think it's easier if you guys as a program would contact the Cedar Valley Center for Center and say, yes, at Blessed Beginnings, we are in need of children's-sized masks and whatever, and work that way so you can get it for your program, and then you have a possibility. So I just wanted to give you guys that resource because I know some of you maybe have your things in check, but I just wanted to let people know about that. And then Becky maybe wants to quick talk about that handout that I think if it's in the chat, if you can see it, but we can send it out after. And I can pull it up too if you want, Becky.
Well, this was one that Beth actually found it and sent it out this morning. And it was on the social emotional development of children and mask wearing. And I forwarded it to the centers and homes that I have on my list. So some of you probably got it, but some of you did not. I'll go back through that center list and try to make sure that everybody gets that. I think, Sarah, you put it added it as an attachment.
Yeah, I'm gonna try to share that. Yeah. Can you guys see that now?
There, yeah. It's helping children understand emotions when wearing masks. This is a really good guide if your staff are wearing masks, especially when we're talking about young children, because they are developing their social emotional skills. And and then the other piece, and I've been talking to Penny out at Hawkeye, is the clear masks that were developed for deaf people so that they could still lip read. And I've been making some of those masks. I think I have about 6 done, different kinds of, I keep going back to the drawing board to make those clear masks so that you can still see the facial expression. In fact, I have one up here. So if you can see that.
Who doesn't hear well and has to lip read.
So
this has been good for her.
It's got a one-way valve here. This is not my favorite one. I did another one that has 2 ventilation spots on the side with double fabric for filtration. So that the problem is they're hot unless you're in the air conditioning, but you can actually buy these masks online. I think the cheapest I've seen them is $7.99 a piece. So, and I made this one out of a page saver and some bias tape and elastic, a lot less than $7.99. It needs more ventilation, so one on each side works better. So Penny, I'll get some to you, and I'll bring some out to Jess too, and we'll see how they work. Kind of an experiment, especially for those infant toddler rooms where they really need to see those facial expressions. So
that's a whole nother layer of thinking about, you know, with the whole mask and the safety thing, but you're bringing up, which many of you have maybe thought about, but that social emotional piece, how kids are learning language, how they're seeing emotions, how they're seeing expressions, you know, and so that's a whole nother layer. But we just thought this resource might be good. And just to quick bring that up when Diane was talking about mask. Okay, other questions from you guys? What are some other questions or things you want to share?
One thing we'd like to share from Cedar Valley is that we do have people that we have had with us for years that are not staff, but they're part of what we call the visiting curriculum. One is a retired librarian through Traveling Tales, another are people with Pet Pals, another is our music therapist, and so on. Those people have primarily been meeting outdoors on our playground with the children, socially distanced, with them having masks on. That's been working really well. In fact, one of the children noticed that the birds were singing with us when we had music outside, and wasn't that a nice addition to our music? So that's worked very well. Also, we would like to share that UNICEF, the United Nations International Children's Emergency Fund, has a very short video. I saw it on television the other day. It is called COVID-19, A Thank You to Children. And it is basically thanking children for playing their part in the whole issue, like washing hands and sharing smiles and things, because it helps to appreciate and let them know how they're helping and how they're being thanked for it. It's very short, but we plan to share it with our children. I know sometimes we forget about what this means to them in terms of the constrictions on their lives too, and the mental health issues that they're undergoing with some of the changes, not being able to see some of their loved ones, not being able to play with the children next door perhaps, and things like that. So it really is a very short 30 to 60 second kind of commitment in terms of the time for it, but it's really well done.
Thanks, Linda. Other questions or sharing?
Hi, this is Jay at Community United. We have a question about like the positive case in the center with posting and the contacting families. You know, I understand you post it in a public place, but then if you're trying to contact the parents who have it, are you to contact every single parent, or can you be more specific and call just, okay, hey, it's in this room, and say you may have had a positive exposure?
No, what happens when you have a positive exposure in your center, due to confidential reasons, we cannot give out if it was a staff or if it was a child or the room that it was in. So what happens is you will be notified either by someone here at the, if you're in Blackhawk County, by the Blackhawk County Health Department, that somebody at your center has tested positive, and that that's all that we need to know, or you need to know. And then you post a sign at your entry or your parent information board. Now, I guess it's going to be at your entry to the facility, that someone, and we, like I say, we don't give out who tested positive, but there has been a positive case. The only, that way it protects everybody, and then it's up to the parents' choice. We get numerous calls once it hits a center, believe me. My phone doesn't stop ringing. So what I tell them is, you know, it's a positive a test, it's everywhere. It's not to say that it was just happened from somebody in the center. They could have caught it anywhere out in the public. And so we still, if you are still welcome, we have not closed them down. You can still bring your child there if you feel comfortable. If you don't feel comfortable, you have to follow the policies, whether it be a center or a home, as to when you pull your child out and how long the child's going to stay out, okay? For the person who has tested positive, they would be out for the 14 days. When and if their condition improves, they can return after that time. If they're still sick, it would be longer than the 14 days.
I guess so, kind of more where the question we get kind of specific is with that, the Department of Health guidance they talk about with the close contacts should be instructed to self-quarantine for 14 days. So I guess I should say the close contacts,
Right, and when you talk about close contact, what they're talking about.
We're going to call 200 of our 200 parents to say, hey, you need to go possibly get a test or self-quarantine for 14 days when it was somewhere, 300 feet away or whatever.
So Jay, are you asking like what your procedure would be to let all the parents know? Is it a sign, or are you asking should we be contacting every parent? Is that kind of what you're saying? What's the best way to do that?
I get, because when you post in a public area, every parent that comes in is, more than likely going to see it. But in the guidance from the DHS from the 23rd, it talks about, it says close contacts should be instructed to self-quarantine for 14 days. So how do we tell if it's a close contact, if it's, let's say it's in a 4 and 5-year-old room and you have an infant, well, they're not a close contact. So I can specifically call and tell people in that specific room that, hey, you should self-quarantine for 14 days. That's where we're kind of confused.
Diane, does the public, I just listened to a webinar, a Mason City one, and it was my understanding, at least up in that area, that, okay, so say there was a positive virus in a classroom. And so then you've contacted DHS and public health up there, their public health people, it sounded like, they were doing like what is that called when you start?
It's called contact
tracing.
Yes, and they're the ones that make the phone calls to, so there's 10 kids in this room, and they're the ones who are calling those parents to tell them. And so that part is all taken care of by them, not by center people. It's taken care of by public health, right?
Right. You are correct. That's why
you're totally out of the loop as a center. It's just, they'll let you know that you have somebody, but all the other issue gets taken care of by public health.
Exactly, right. When somebody goes in to get tested, the test results, depending on where they go, if they go through Test Iowa or for their own family physician, the test results come back to their family physician, and they also, if they are positive, go to the State Department of Health, and then the State Department of Health will contact the local health department, and then the investigation starts out. They go through a bunch of questions of where the person was and everything, and then they start taking those, that's what they call the contact tracing, as to where those people, that person was, and then start contacting those people that they may have had an exposure. And by exposure, with the COVID, we mean that you are in closer than that 6-foot distance that we keep on talking about, that social distancing or physical distancing, for more than 15 minutes at a time. Okay, and that 15 minutes can be spread throughout the whole day. It just doesn't have to be a consistent 15 minutes. So that's why when we look at the classroom, we go like, uh-oh, he's been in, this teacher's been in this classroom with these 10 kids all day. Teacher tested positive. So then those 10 kids would also have been exposed. Does that make sense to you then?
So then, let me jump in. So from Jay's question, so if you as public health calls and says, okay, there was a positive case at your center, and I mean, just figuring that out, I think I'm hearing that they're trying to figure out how much communication too do they need to notify parents. And because then my next question was, Diane, if they are asked to post something, do you have something already made that we can send out to programs that they have that on file, so then they could print that out, so they're using the same type of, posting.
Yeah, I think I sent one out to one center, but I'll make another one that you can send out. The posting that all we just use comes off of the CDC, the symptom chart. I think you can find it on the cdc.gov, and just the signs and symptoms of COVID. But then I tell them, just put notice, someone has tested positive here at the center on such a date, and we're, just watch on a day-to-day basis for your child or your personal staff people or, you know, other family members if, for signs and symptoms of COVID. And then if the state or somebody here at the local health department would call your center and say, hey, so-and-so tested positive. And a lot of times you're going to hear from the person or from the family member that tested positive before we get the results back. And then they usually tell you that as a director or a home business owner of the child care center, then you need to call Department of Human Services and let them know that you had somebody tested positive. And then
so that would be Becky Frost and our Blackhawk staff, our directors. Yeah.
Right. And then she will give directions. It goes to the telephone communication key that they notify me, they notify the state. And I mean, it's just everybody gets notified. So we are aware of the situation. It all depends sometimes depending on where the person gets tested as how quickly we get the information.
Can I ask you one clarifying question? I got lost in that 15 minutes. When you said like they need to be, I had never heard that, so sorry, that may not matter.
Yeah, this is what we call that social distancing or the physical distancing, where you need to keep the people 6 feet apart, a minimum of 6 feet apart. So we know little kids love to hug each other, you know, they're playing, we get it. That's part of life. So other people, when, as adults too, when you are out and you see people closer than the 6 feet for more than 15 minutes, that's what we're talking about. They can be standing side by side each other, having a conversation. But if one of them was sick and tested positive for the COVID, okay, then that other person has been in close contact with them within that 6 foot distance, okay? That's where we're talking about for more than 15 minutes.
Does it matter if they had a mask on in those 15 minutes, or is that like if they both are in that close proximity and one of them doesn't have a mask?
Right, it could be either or, because right now the mask is not 100% proof to stop COVID, but it is another barrier, okay?
So Diane, so you'd said something a little bit earlier that I'd never heard before. So I pictured 15 minutes meant I'm standing here 15 minutes in front of this person and we're talking, you know, within a 10 to 10, 15. You're saying it's a total cumulative amount of time. Somehow that went right over my head.
Well, and that's why we say we try to keep, and that's that 6 foot distancing throughout the whole day in the classroom or in the child care center. Obviously it's not going to happen.
It's impossible, yeah.
Humans, you know, that's why we're coming in and trying to clean up in between and keep the mask on as much as possible, or send those kids outside, weather permitting, obviously. But that's the big issue, is trying to get these schools back open. Do we need to put plexiglass around the desk? You know, how do we keep the kids all faced one way? Or, you know, it's a challenge. And then some people are not getting sick when they are positive.
So, hey, Diane, so from Jay's question too, it sounds like these are good times to already or think about putting some procedures into your policy, or this is how we're handling it. Because maybe say one center's procedure is, we're not going to contact everybody by phone. We're going to put up a posting, or we're going to take guidance from public health, or you'll be you know, I think they might need to talk through some of that with you for their own policy of how they're going to do that. Because I'm hearing maybe a tweak of that from Jay is how we're communicating that, how, you know, and maybe our parents expecting, well, I expected a phone call, you know, I don't know what the answer is, but I think you guys, that might be procedures that you're coming up with. How are we, you know, I hear Diane say that there needs to be a posting. Okay, that's probably one of the procedures, but how else? And if parents are expecting one way, but here's what we're doing, that might be something to think about in your procedures and stuff for the future. This is at least now how we're handling it. And we've gotten our guidance from our Blackhawk County Public Health, you know, you utilize them and put them in there, you know, that you guys are partners, you know, that you're really working on this together.
We're trying to keep everybody open as much as possible, but it's really hard because we got people, as you know, you've seen it, they're out there running around without masks. It's just breaks my heart to see these little people. I love baseball games, but drove by the other day and saw a bunch of little kids playing, and oh dear, what's going on here? People sitting on bleachers close together. This is not a good thing. And that's, one of summer sports, the kids need to get out and be physically active, but again, do it safely. I think
we need to wrap up real quick too. It's 2 o'clock. So if anybody, we could spend a couple more minutes to kind of, but if anybody needs to get off, feel free to go ahead. What is the census of though? Would you guys want to do another kind of Blackhawk directors meeting, in the next 2 weeks or something? At least try to do something regularly once a month right now to share some information. What do you guys think about that? Can you click on that yes, no? Does that work in this thing, Brenda? I don't know if that works, but even if we get 10 directors on, it might be worth those 10 directors, and we don't mind having a Zoom meeting to have you guys network. So we might go ahead and try that in the next couple of weeks too, just to see, but we want you guys to be able to share and talk. So so those that can stay on, we'll just maybe stand for a couple more minutes, and those that need to jump off, go ahead. So I interrupted somebody, I'm sorry, go ahead.
Hey, Sarah, that was me.
I got
go ahead.
In before, I'm sorry.
Go ahead.
So I'll give a specific example, or not specific, but I guess example. So we find out that Sally Joe's little T-ball boy was contacted, and they called and told us. And so we know specifically that day that there were 10 kids in that room that was in probably direct contact, close contact, 16 minutes for the total day, either way. Department of Human Services is going to call them, or Department of Health, as opposed to us that day saying, hey, all of you kids probably should not come back tomorrow. That's where we're frustrated, because we want to make sure this pure speed that we can contact those parents, and we know who all those parents are. That's just where I'm kind of frustrated.
Well, this morning.
Jay, this is Becky. And I am in close contact with Diane all of the time. Every case I get that's reported as a positive, whether it's a child or a staff member. And she's right, there's confidentiality where you can't say if it's staff or child, but we have been, as you know, if we start out, if there's a positive in a room, we close that room. So, I mean, you can say we can't say which room it is, but although that we're going to close that room, and it's going to be closed for 14 days. So it's pretty obvious which room it is. And yes, the Blackhawk County, whether it's Diane or someone else, is contacting people, the close contact people, and doing that contact tracing. But I guess what I've always advised centers to do is to get ahead of it and email parents in that room, or email parents in the center to let them know you've had a positive case, because this is a hot topic, and the reaction has been, we get complaints if they hear about it from an outside source, or if they don't feel like a center kept them informed. So I don't think it's anything. What you're required to do is put up a posting. What I recommend you do is notify parents, let them know you've had a positive case, and you can let them know, that you close the room, because you have to contact those parents anyway and let them know that those kids have to self-isolate for 14 days, that they can't be at that center. So, to me, it's best to have that open communication with parents, because if you don't, we will get calls, whether it's required or not. The only requirement is that posting from you guys, but I think best practice would be for you guys to reach out to parents so that they know that open communication's there.
And some of you maybe have a remind system, a texting system, an email, however you do that. That might be another procedure or a process to think through of time saving and things like that. So yeah, I would agree. We've heard complaints like that too. So I, look at recommendation versus, have tos, and what might support families too. So. Okay.
I can also,
go ahead,
Brenda. I was
Brenda.
just going to share quick, Sarah. We cover 18 other counties besides Blackhawk, and we are keeping track of exposures, and you know, we don't give that information out to anybody. It's just for our records. But we had one case in March, 2 in April, 1 in May. And since then we had 11 in June and 18 already in July. So you can see what that chart is doing. So vigilance is really important right now, and everybody's really sick of it, including me. But we can't let off the gas now.
Right. Well, we will try to do another one of these. I think that some people would be interested, and then if we have more to share, like I said, we'll do a bigger one for our whole region. That I think there's one coming up, and you'll see those emails. But and we'll try to get back with some information around policies and maybe some talking points to have you things to consider for policies. So we'll work on getting that out to people that attended, or at least via email to constant contact to directors. So we appreciate your participation and want to continue to have opportunities for you guys to share. So thank you guys for what you do every day. And again, just reach out, obviously Diane and Becky Frost, but any of your CCR&R consultants will all continue to work together to support you guys. So thank you.
Thank you.
Thank you.
Bye.